inviting me for this talk. So what I'm going to do for the next 30 minutes, I think I've got, is talk about the oral glucose-lowering drugs and their effects on cardiovascular outcomes. I should just declare some interests, which you can read there, but perhaps relevant to this talk, I was an investigator for quite a lot of the trials I'm going to talk about, particularly TCOS, Examine, the Canvas trials, and I'm on the steering committee for DECLARE, which is the outcome trial with dapagliflozin that has not yet reported. I think everybody is aware of this, and we've probably heard more up-to-date data already from Sarah early this morning. I think everybody knows that diabetes is associated with increased mortality, and that a large amount of that is due to vascular disease. And historically, of course, we have been very interested in whether our treatments for diabetes will make a difference to this scourge of cardiovascular disease in people with diabetes. And we do know from UK PDS and from other studies that intervening with risk factors other than glucose, such as blood pressure, and if we look at the statin trials, both in primary prevention, I'm not going to go through these in detail, but they all show benefit, and in secondary prevention, we do know that managing these risk factors is really, really important in our patients with diabetes. But I think that the area of glucose control has been much more controversial. And even in the UK PDS, we had to resort to epidemiological analysis and long-term follow-up to demonstrate in an indirect way that glucose lowering might actually make a difference to cardiovascular outcomes.